Well, he's awake. He might be hungover, definitely sobered up. He went to the Going Digital Behavioral Health live cocktail party to kick off the conference last night. Let's find out what happened. It's the June 9th episode of Health Tech Deals.
Yes, Jess, I was there at the NASDAQ Center in San Francisco. Salome Tibibu running her Going Digital Behavioral Health, I can't remember what the hell that thing is called, which we're not on this year. We were on it last 2 years. Obviously, we ran out of stuff to say.
Either that or we wore out our welcome.
But your fans were out in force, I suppose.
Oh, sure.
Of them, including the one who said that he liked it because you were abusive to me.
Yeah, you sent me this video about how it's like host abuse, and it's like, here I am thinking he's talking about how mean you are to me, and instead, no. Other way around.
Bob Nix from Rio, one of your big fans. Apparently he likes you doing it, but yeah, it was good session last night. There are still a million new behavioral health companies coming out of the woodwork. I met like 4 or 5 new ones I'd never heard of last night, and what's a good gossip?
I saw on Twitter that Salome posted there's more than 5,000 people register for that conference. Well, which is pretty awesome. I mean, I remember when that started, it was like
it was a few thousand. Also,
cool.
Doesn't cost anything to go, but she's got a ton of sponsorship. So
that's awesome.
That's fantastic. No, it's great. In fact,
and didn't you just watch the pitch day for What's Next Ventures?
What if? Yeah, what if?
What if?
Lots of. I mean, that's like a tiny incubator. I mean, they're both a venture syndicate, but also run a tiny indicator for cool stuff. I actually saw Peter Hames, your friend from Big Health. I told him who he has to buy. There is a Brazilian equivalent who was at the What If Ventures. So I'm making deals, drinking red wine, finding out about you're abusing me. It's all going on at that one cocktail party just for a couple of hours. And I rode my bike there and some of the way back. Very healthy.
Okay. Mm-hmm. Yeah, what I heard you say was you just ate a bunch of free food, drank a bunch of free drinks, and then spent a bunch of other people's money.
Kind of stuff I like to do.
Par for the course. Matthew Holt does health tech conferences.
All right. By the way, talk about health tech conferences. What are we supposed to mention?
AHIP. We're going to AHIP. It's coming up, not next week, but the week after. And if you want to register and join us there in beautiful Las Vegas with all of the health plan folks that you could possibly want to meet, head on over to the AHIP website. And when you reg, use the code THCB to get $100 off the registration price.
My God, your voiceover promos are great. You can be selling beer on baseball commentaries, just like Harry Carey used to.
Yes, all from the AHIP conference discount to beer on baseball.
Something like that. On the other hand, deals happening again.
Yeah, money back all of a sudden. Here we go, big round. $140 million for Carebridge brings our total up to $180 million. Oak HCFT led this one. What do they do, Matthew?
So this is at-home visits for Medicaid, including electronic visit verification, which is part of it, and a whole bunch of clinical support for disabled and at-home people for Medicare. So Oak's in this. They also funded Main Street Health. So Brad Smith, who used to be at Aspire, which was a palliative care thing that got sold to Anthem, now runs this thing. Amy Gleason's involved at Main Street Health, and they funded a bunch of other stuff, but he's the executive chairman of this one, which is Carebridge, which is the biggest one yet. And Oak HCF has funded that, and is in this one with a bunch of Medicaid plans. This is obviously a extremely big deal in this area. There's some scuttlebutt about Smith and how he did this and what he was arranging while he was working for Medicare, and did he slot the thing so that this would be more popular? You might talk to, there are some people like Sachin Jain and others who don't particularly have great things to say, but I think it's an interesting area that as Medicaid does more and more care at home, you're going to see more and more funding like this.
All right, Nava Benefits gets $40 million in a Series B, kicks their total up to $60. Thrive Capital led this one. There's a ton of investors in this.
Yeah, this is sort of as far as I can tell, this is basically a sort of HR professional review search engine of different benefits that you can do. So I don't know much about it, but there's probably a lot of help required in that area, kind of taking what Mercer and LeanTaas probably do for the big guys and bringing it down a scale.
All right, what about Bicycle Health? They are a telehealth clinic for substance use disorder. They're focused on medication first kind of approach. They get 50 million, brings their total up to 80.
So many of these people, right? Addiction, substance use disorder, mental health. They have both a direct consumer option for like $200 a month, but also selling the health plans, group therapy, medication, and all the rest of it. A lot of a crowded space here.
All right, lots of buzz about this one. Bain Capital buys LeanTaas. Explain this to me.
So LeanTaas is one of the many companies doing kind of data integration for hospitals and doing sort of hospital operation AI stuff like that can improve hospitals. They have 500 hospital clients. They raised 250 million. The other people you may know in this space is Cuventus, our friend William Gardner's people there. So like trying to figure out how to make hospitals work more efficiently using data. So theoretically a pretty good idea. I don't get this. So Insight Partners and Goldman Sachs were in this and they bought them out completely. So Bain Capital now has bought this, presumably taking it public. How much, we don't know how much they spent. We don't know how much money these guys are making, but they're probably doing okay if they're 500 hospital clients. And this is one of those things where what is happening inside the hospital is getting more and more complex and confusing. I spoke, by the way, with the people from Graphite, who I said that it sounded to me like they were just the same as Judy Faulkner's Epic App Orchard, and somewhat similar to Commure. And having had a long conversation with them, I'm not a lot clearer as to exactly what the difference between all these people are. But clearly, what's happening inside the hospital and who is drinking whose milkshake in the hospital technology space, don't know who came up with that idea, is going to be a bigger and bigger deal as hospitals need to get more and more efficient. The other thing that's going on, right, is can you replace labor with intelligence? Because hospitals are out of labor. There's just how many people do we see get funded who had the hospital staffing agencies? About
oh my God, like dozens.
Yeah, so that's LeanTaas. Interesting. Hopefully we'll find out more one day when Bain Capital sells when they go public. But with these private equity deals, it's very murky as to who's doing what and how much was paid and how it's going. So one day we'll find out.
Yeah, lots of buzz about this one. They've been around for a long time, I think.
About 2010 they started, and I think a lot of companies were started in those early days around sort of health catalysts and that kind of thing as well.
Yeah.
Data on the inside of hospitals make them more efficient. How all that works, I don't know. Hospitals are very confusing to me. Those should all be put out of business soon, but apparently not yet.
Well, they've got those robust investment funds that you love to talk about.
They do, although I spent the last few months, they probably aren't quite as robust as they were before. But it's like my friend, the stock analyst who wrote to me in late 2019 saying, this stuff is incredibly expensive by historical standards due to sell everything. I spoke to him the other day. He actually said he did sell everything in January. I said, well, hang on, but if you'd sold everything in 2019, did you miss out on the 2 years of it went up before you sold again in January this year? And I, of course, rely on your advice, so I bought everything in January.
Oh, right. Yes. You're going to throw me under the bus for this because you did not listen to me. You heard like pieces of my advice and mixed up buy with sell and sell with buy. And now it's my fault.
Buy at the high and then sell at the lows. I haven't sold.
Are you going to join the class action lawsuit against Teladoc?
Well,
I saw that and I was like, oh no, I know how much you love to complain about your TDOC stock. And I was like, here's some people taking action. Class action. Like,
I mean, look, there are class actions against any stock when it goes down by a huge amount. They say the board misrepresented this, that, and the other. But I mean, how can you be real about a stock that goes from whatever 50 to 300 and make down to 50 and back to 30 and after 100?
The article I read on it, I can't remember where it was at, but they were talking about how it was just like Teladoc grossly underestimated the level of competition in the chronic condition management and mental health care space.
So I did talk to Marty Fellensoul last night, venture capitalist.
Take a running start and try that again, please.
Marty Fellensoul, my friend, the venture capitalist from Health Velocity Partners. And he said, look, it was very unfair for those people because there were 4 big companies, right? There was Teladoc, Amwell, Doctors on Demand, and MD Live doing telehealth. And they were all, happy the people that they used. But as soon as the pandemic happened, everyone had to move on the Zoom and FaceTime and Doximity and DoxyMe and, it messed up their market completely. So he says that actually the pandemic sort of hurting those companies, actually helping those companies, actually hurt them all because telemedicine is this big thing and no one understood the difference between them. So you might be right. So let's blame the pandemic. I'm going to sue the Chinese government, fish market, lab, whatever, wet market. Somebody somewhere can be sued, surely.
Well, let's learn a valuable lesson here that it's like nobody could tell the difference between those four that had been in business for like a decade plus, all of them. So new health tech companies now, make sure you do your comms job early on so that when that happens, people can tell the difference between you. We're looking at you, kidney care space. We're looking at you.
Among others. Among hospital patients.
All right. Okay. For more complaining about the Teladoc stock that he's purchased and holding on to, head on over to Twitter and follow Matthew at BoltyBoy. I'm over there at Justamasa, not giving out any stock tips at all, ever again to anyone. Not like I even wanted to in the first place. I was pushed. And to never miss an episode of Health Tech Deals, head on over to thehealthcareblog.com and sign up for our email newsletter. You'll get all of these episodes and the best from the blog delivered directly into your inbox every week or so, whenever we feel like sending it out.
Coming very soon, I promise.
Yeah, sure. I'll hold my breath for it. We'll talk to you guys soon. Bye.